Hi, this video is the art of hair transplant restoration surgery on an Asian man who has a class 4 5 hair loss pattern, and he's been waiting for many years, and after doing quite a bit of research, he is not convinced with the strip method. The FUE is the way to go, and with the advent of and the improvement of the FUE, so we can now harvest at least 2,500 grafts or more and work our way toward the back. So 2,500 grafts tend to be from the hairline toward the middle of the head. For the average sized head, some people's head is a lot bigger, than more real estate to cover, and more head to cover than just 25, but 25 is a very good starting point for him. And then next year we can always, or a few years down the line, we can always do the back, and then he'll be done in the future. You know, with advanced hair loss, you're going to need more than one surgery, for sure. But for this client, 2,500 is a good starting point. We harvest by the FUE method, FUE Follicular Unit Extraction, and pull one root at a time. Leave you tiny dots of scar scattered throughout the back like mosaic pattern, allow you to wear your hair shorter. FUE does leave scar, so no surgery without scar. The FUE leave you minimal scar, it's less visible, versus the linear scar by the strip method, we'll call the FUT, leave you a linear scar. The FUT is more invasive and more painful than recovery, but the FUT works very well for advanced hair loss, guy with 5, 6, 7 hair loss, where you lose all your hair and you need to move like 5, 6,000 a day, then the FUT will be good. However, if you have minimal hair loss or mild to moderate hair loss, the FUE is better, unless you want to save more money, then you can go with a strip, but then you get what you pay for, right? The FUE is why it costs more, because it's more labor intensive. I'm pulling one root at a time, results to tiny dots of scar. So getting back to this patient hairline recreation or restoration is an art form, require a lot of the artistic and aesthetic detail to ensure very natural result. When I create the hairline, it is custom hairline really, because each individual, I base the hairline according to each individual facial structure. From the mid eyebrow to the hairline, average for Asian and Black around 6.5 to 7, Caucasian around 7.5 to 8.5. Other ethnicity, it vary. As long as it's overall proportional to his overall face, as long as the third, mid eyebrow to the hairline is a third, mid gallbladder to tip of the nose the third, and tip of the nose bottom chin is a third. Once you have the whole symmetry and proportional, then we arch back the hairline. The more narrow the face, the more arch back the hairline. The more round the face, the more flat the hairline is. This client actually has a little bit more on the narrow face, so that's why he arched back. And then once we get the shape down, we will zigzag this, no hairline is straight. Now the zigzag is dependent on the preference too, and I do give the patient preference. If the patient want a soft hairline, then have a bigger zigzag. If the patient want a tight hairline where it looks very sharp, then we do a smaller zigzag. No hairline straight. So you know, it's up to an individual. And then once we got the shape and the zigzag down, we transplant at 35, 45 in the front. It increases when you go backward and changes when you go a different direction. The precise angle is important. Selection hair grafts is important. We transplant rows and rows of single hair graft in the front, followed by roots of 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this is the art of hair transplant restoration surgery on a client with frontal volume toward the back, and we will harvest around 2,500 grafts by the FUE method or more, and just fill them from the front toward the back. Thank you.